My name is Shalisha Qualls. This is my sterile dressing change validation #1. So, before I get started, I would knock on my patient's door, perform hand hygiene, provide my patient with some privacy. I would go to my patient. I would say, hi, my name is Shalisha. I'm your student nurse today, and I'm here to perform a dressing change, or it's ordered by your physician. Before I get started, can you provide me your name and date of birth? I'm going to assess my patient's wristband and verify name and date of birth. Patient says her name is Shalisha Qualls, birthday is 12/10/2001. Okay, great, Miss Shalisha. I'm also Shalisha, and I'm going to be doing your sterile dressing change today. Before I get started, I'm going to review my physician's order. I have verified my physician's order. He said he wants a sterile dressing change twice daily. So we're going to go ahead and get through with that, Miss Qualls. Before I get started, can I ask you, are you currently in any pain? She states her pain is a 0 on the pain scale from 0 to 10. Okay, great, Ms. Shalisha. If my patient had been in pain, I would have pre-medicated my patient, then came back to assess my patient to make sure the pain level has decreased before I started this procedure. All right, Ms. Qualls, I'm going to be doing a sterile dressing change, like I said before, on you that the doctor has ordered. So we're going to look at your incision, make sure everything's going well with it. We're going to assess the drainage on it and make sure everything's like it's supposed to be, and there's no signs of infection. Okay, I've already performed hand hygiene. I've already provided my patient with privacy. I've explained the procedure to the patient. Now I'm going to inspect my supplies for expiration and make sure it's in date. Okay, I have my gauze sponges. I have my ABD pad. I have my sterile gloves. I have an extra pair of gloves that's going to be needed. And I have my drape, my tape, and I also have my trash bag. So I know what this is. I know what kind of pad this is, but we were out. They didn't put 2 ABD pads in my kit, so I had to use one to do my procedure with. So I had to put this on my patient and act as if this is my ABD pad. So for this video, this is my ABD pad because I didn't have nothing but one. Okay, so now I'm gonna get started. I'm going to go ahead and I've already performed hand hygiene. I'm going to put on my clean gloves. I provided the patient with privacy. I've already done that. I'm going to go ahead and get started with my procedure. I'm going to carefully tape my patient's skin and hold it taut as I pull the tape up on here. I'm going to loosen it like this. Not too aggressive, very gently. And to loosen it all the way around. Okay. Alright. Just loosening my tape like such. So what I'm going to do is I'm going to remove my ABD pad. I'm sorry, this is sticking to it, but in the real world, we would just hold this down, maintain sterility because we don't want it to get infected. I'm not sterile at this moment, but I would make sure that does not get in. It's sticking because I don't have the right ABD pad. It's not an ABD pad. This is a regular pad. But for this purpose, it's an ABD pad. I do apologize, but they only put one in my bag, like I said before. That wouldn't do that in the real world. So we're gonna just that wouldn't do that because I wouldn't have this type of pad in the real world. But I'm gonna remove my pad as such. Okay. I'm going to place that in my garbage. I would come around. My dress is still covered, so I would come around. Okay, I'm going to carefully remove one of my gauzes. Okay, I did inspect that away from the patient where the patient cannot see. I did inspect that for color, odor, consistency in the mouth. I'm going to inspect this one also for color, odor, consistency in the mouth. Coca. If that dressing didn't come out the bag, had that dressing touched my sheets, I will verbalize that I will change that patient's bed sheets. But it didn't in the real world. So I'm going to remove that one as well. Okay, I'm looking for color away from the patient. The patient cannot see the drainage. I'm assessing the drainage for color, odor, consistency, and amount. Okay, and discard that. Okay, now I'm going to inspect my incision, my surgical site. Okay. So here I will be looking for Rita, which is erythema, redness. I'll be looking for edema. I'm looking for drainage. Okay, looking for my drainage. I'm also looking that it is approximate. So this is not a well approximated site, so it's not approximate. So we're gonna say it's not approximated. Okay. Now I've done that, I'm going to palpate my abdomen and make sure that it's not tender. Okay, it is soft. Okay, I did palpate, it is soft. Okay, now I'm gonna step back. I will remove my remove my gloves. I'm gonna keep these because I'm gonna need them for later. But in the real world, I would discard these gloves in the appropriate bin. Okay. Alright. I've already inspected my material. Everything's within date. So just gonna get that over here and get it started. Okay. Those are my sterile gloves. That's my tape I'm gonna need for the end. Alright. I'm gonna go ahead and get my sterile field ready. Okay. Excuse my table, I am in the home setting. I do apologize. Okay. So I'm gonna perform hand hygiene again before I touch that. Perform hand hygiene. Now I'm going to open up my sterile drape. I'm gonna step back. Also, I want to keep in mind that in the real world, I would have a bedside table and my hands would not fall below my waist once I became sterile. I'm careful with my 1-inch border. I'm opening it away from my body. Alright. So I'm gonna touch this using my 1-inch border. Touch it using my 1-inch border. So just take my 1-inch border and turn it like such. Careful not to lean over my sterile field. I'm not gonna lean over my sterile field. Go to the side of my sterile field to fix it. I would have a bedside table. It would not be this low. It's kind of difficult to reach down when it's this low, but I'm going to be careful and touch my 1-inch border to fix my sterile field. I'm not gonna reach over. I'm gonna come to the side. I would not reach over my patient in the real world. I'm gonna make sure I maintain sterility. Okay. Once I have done that, I am going to discard of my trash. This would be up more. My hands would not be over. I would not be able to reach it. It's kind of difficult right now with this being so low, but we're going to continue. Next, I'm going to take my items that I would need for my dressing change. I will open those. I've already performed hand hygiene. I'm just going to open it like such. This is my ABD pad. Open it away from my Sterifield. I'm just going to dump it. Step back. I will put this in the appropriate trash bin. Okay. Next, I'm going to get my gauze. Open it. Okay. I'm going to take all of that off. Dump it. Okay. I'm going to keep this because I will use this for my drainage that I would need to soak my gauze. So now I'm going to open up. The inside of that is still sterile, so it's okay. This is my sterile gloves. I'm going to carefully step to the side and open up my sterile gloves. Alright. I'm not reaching over my sterile field. My back is not turned to my sterile field or my patient. Okay. I'm going to open them up. And that glove did get caught right there, but that's okay. I'm not touching the inside of these gloves. I'm still on the outside of them. Okay, we're just not going to worry about that at this moment. Just going to open it up so we can maintain stability. Okay. Those gloves are caught on the side of that, but it's okay. So, what I'm going to do is, I'm going to touch the outside. I've already performed hand hygiene. I'm going to touch the outside of it. The inside of it, I do apologize. I misspoke. Inside of it. Step back a little bit. I'll place my hands directly in them. I'm still touching the inside of it, as demonstrated in our video. So that's okay. Okay. Right now, I'm just going to get the gloves on. I will fix them later. Still touching the inside of my gloves, okay? Alright. I'm still okay. They look a mess, I know, but I'm still okay because this is still sterile. So, just going to take this. Sterile can touch sterile. So, I'm going to just take this glove over here. Okay. Step back. Insert my hands in here. Like so. I'm going to touch the inside of it. Alright. Now, sterile can touch sterile, so now I'm going to go ahead and fix my gloves. Keeping my hands above my waist. Okay. Fix my other side. Because I'm still sterile. Sterile can touch sterile. I'm still touching it. I'm touching only the outside now. The inside is in the inside. My hands are above my waist. Okay. In this moment, I I'm going to, they did not put any normal saline in my kit to put inside of my sponge tub. But now I am going to go ahead and pour me some normal saline in so that I can clean my incision. So what I'm going to do now is reach down, get me a sponge, soak it, take it out, put it in this hand. Okay, I didn't reach over my Sterifill. I'm going to go right down the middle of my incision and clean it out. All right, hands are still up. Okay, that's not anywhere near my Sterifill, so I'm still okay. Hands are still up. This is my dirty hand, so I'm gonna ball this up. This hand is still clean. Gonna reach over again, get another one. Okay, gonna soak it. Hand is still clean. Drop it into the dirty hand. Got it. In this instance, I would wipe the one that's farthest away from me. Alright. Come to the side. Discard it. Hands are still above my waist. I did not turn my back on my Sterifill. Gonna do it again. This is still my clean hand. This is my dirty hand. Gonna soak it up. Drop it. This hand. Gonna clean this side. Alright. This is still my dirty hand. Discard it. Hands are still up above my waist. Now I'm gonna take it and I'm gonna dry it. Okay. Straight down the middle. Dirty hand, clean hand. Get another one. Drop it. Straight down the side. Okay. Discard it. Hands are up. Another one. It's dry. Drop it. Dry it, pat dry. Discard it. Hands up. Never turn my back on my Sterifill. To the side, I kind of went to discard it. Hands are still up. Okay, I'm gonna take my dirty hand. I'll put it behind my back, but it's still above my waist. I just don't want to use it on accident. So now I'm gonna take my clean hand, get a clean gauze, step back from my patient, place one, drop it. I never touch my patient's incision, never broke sterility. Get another one. It's clean. Notice I never touch the part of the gauze that's gonna touch my patient's skin. Drop it. Okay. Gonna grab my ABD pad. Never touch the part that's gonna touch my patient's skin. Okay. I'll put it on like so. Okay. Hands are up. Now, in this moment, I can discard my gloves because the wound is covered and I'm no longer having to be sterile. So, but I'm not going to discard these gloves because I only have one pair and I need them for my tracheostomy care and suction video. We're just going to remove these gloves. Remove them, remove them, remove them, remove them, remove them. I do know the proper way to remove gloves. Let me admit that and say that, verbalize that. But as I said before, in this instance, I'm not going to throw these gloves away because I need them for my trach video. And they are my sterile gloves. But I do know the proper way to remove gloves. Okay. I would discard those in the appropriate being in the real world. Okay. I'm going to perform hand hygiene in this moment. Perform hand hygiene. Okay. I'm going to get me some tape. I can really discard this in case I need to still be considered sterile or clean. I will perform hand hygiene. Gonna get my tape and my writing utensil. because I'm going to label my tape. So I don't want a crazy piece of tape. I'm gonna discard that because I don't. That's not I would discard it. So I did perform hair hygiene. I'm gonna put some more gloves on. Put some clean gloves on. These are a new pair of clean gloves. In the real world, these will be a new pair of clean gloves. Need some tape. I don't want a crazy piece of tape. Not crazy. And that wound is kind of hard to dress because those ABD pads and gauzes are so big and that wound is so small. But I'm gonna just tape that down. Enough where it will stick. Don't come up. I don't want a crazy big piece. I want just enough to hold my patient's dressing down. Okay. It's kind of hard to peel this tape with these gloves on. Here we go. Struggling with the tape. Alright. Gonna give me another piece. I don't really need a too big piece for the bottom. So we can just do this piece. Like I said, it's kind of hard to do this because this ABD pad is way bigger than this dressing. But I would tape my bottom piece as well. My side piece as well. This is my final piece right here, over the top. Okay. I will take that piece as well. Okay. Now I will take my writing utensil and I'm gonna go around here to the side and I will put my initials, JQSN, East Central Community College, ECC, and I will put today's date, 11/14/2025 on there. Okay, then I'm going to go ahead and remove my gloves. Let me demonstrate the proper way to remove gloves since I probably won't need these again for trach. Okay. This is how I would remove my gloves. I would dispose of those in a proper bin. I would come over here. Okay, Miss Jaleisha, I've cleaned your dress and I've assessed it and I've noticed the coca color odor consistency in the mouth, and I've noticed the redness, edema, drainage, and approximation of your room. I've seen all this. I'm going to go document that and notify the provider. I'm also going to put my patient's bed in the lowest position. I'm going to let my patient's head up 45 to 90 degrees according to whatever protocol my patient is on, whether she's on aspiration or whatever protocol she's on. I'll lift her head to bed to fit that protocol. Then I'm going to put her call bell within reach. I will place her bedside table within reach. All her personal belongings will be within reach. Safety rails, side rails will be up ×2. I will make sure my patient is okay, comfortable, doesn't need anything. Make sure she's okay. And I will perform hair hygiene. I would cover my patient up, provide privacy still, cover her up, maintain dignity, discard all my material in the proper bin. I would start to gather my supplies and throw them away, discard them in the appropriate bin. That was supposed to be my biohazard bag for like the bodily fluids. If anything fell on my patient's sheets, I would change her bed sheets. But okay, so put all personal belongings, call, but everything is within reach. I would perform hand hygiene. I would go document appropriately. Oh, I would tell my patient, please do not touch your incision. Don't scratch it. Don't mess with it. If you notice it's itching, burning, if you feel pain at the site, if you feel like it's draining, oozing, please notify me and let me know so I can come and assess and see what's going on. Now I will perform hand hygiene and I will go document appropriately.